Hi, I'm Scout, the Executive Director of the National LGBTQI+ Cancer Network, and I am here at Roswell Park today, and they have a mobile lung cancer screening lab, which is really exciting to us because lung cancer screening has been a big focus of ours. We have a new campaign that we have out there, and also our communities smoke at higher rates. But screening is often a mystery. So I thought we would come over and talk with Ashley here, who is one of their queer identified health system navigators, and have Ashley talk us through, if you were referred for lung cancer screening, what would it actually mean for you? So with that, what do we have going on here?
Great. 5 minutes of your time, you step in. That's all it is 5 minutes. If you are between the ages of 50 and 80 and have a history of tobacco use, it's like a 20-pack year history, or if you're a former smoker, which kudos, because that's really hard to do.
Yeah.
As long as you've quit within 15 years, depending on your insurance, whether you need authorization or not, you just go right on, get screened, and get your results back as soon as possible.
So for most people, this would be free too, right? Because there's programs to help people if your insurance doesn't cover it?
Yeah, for sure. We have some programs in the area that help kind of offset if you're uninsured or underinsured. So that's definitely helpful and supplemental. So, yeah.
All right, so only 5 minutes. Tell me what would happen.
Yeah, you walk on the bus. You're greeted by our lovely staff.
You gotta walk on the bus now, right?
You gotta go.
You gotta do this.
Gotta take
Exactly.
a look.
All right.
Yeah, so welcome to Eddie. This is the waiting room where folks who are here for lung cancer screening come kind of get their intake, make sure that all of their documentation and stuff is valid. If shared decision making hasn't been done by the primary care provider, then that's a quick conversation that's had with the PCP on the unit. So it's able to be done like live time.
Excellent. And can I point something out over here?
Yes.
The clinical trial opportunities, they have flyers up about it here. And the reason why that's important in cancer is because in cancer, clinical trials are usually the best potential care you can get. So if you're in this situation and you're offered an opportunity for clinical trial, understand that's usually going to be the best possible care. But of course, it's also harder for us because we have fear of some doctors. So we try and encourage them to take steps to make sure they're more welcoming.
Yeah, so our waiting room, this is where our wonderful staff sit. So we have a patient navigator that helps to coordinate like me. She's dedicated specifically to the mobile unit, so she goes anywhere that Eddie goes. She helps to make sure that the schedule is filled, all of the orders have been placed, insurance auth. She's literally awesome. We also have a PA on the bus that helps to look over the scans, read the scans, so the provider. We also have our CT techs that come, so it's a huge team. So now, this is where the magic happens. Okay. This is the low-dose CT unit that patients come onto to get screened. Again, it takes about 5 minutes to complete. Low-dose CTs are better than x-rays. They get a three-dimensional picture of your lungs. Better picture means you get to see everything. So. It's really great. I know it's huge and it probably could maybe sometimes feel scary or look scary, but our staff is here all the time. And
is it loud like an MRI?
No, it's not loud.
Really?
It's pretty quiet, honestly.
Are there any needles involved at all?
No needles.
Any scalpels?
No, none of that.
You come back with all your limbs?
All your limbs.
And it's only, so there's actually, you don't feel it, right?
Nope, you don't feel it. Nope, you just get on the table.
Any side effects? Any after effects?
No.
No.
Not at all.
Huh. So this seems pretty simple. It sounds like our biggest barrier is actually realizing we need to get screened and getting referred in here in the first place.
Exactly. And that's why places like Eddie exist, to help kind of increase that access.
Make it easier. Then one other question, just the obvious one. Why should you get screened? Are your chances of having it be treatable, like, it's lung cancer. We all know it's scary. Is it that you could have more of a chance of a cure if it's treated early? Or
Yeah, absolutely. You're hit it right on the nose there. It's early detection is key, and that's why we do the prevention and screening that we do. Your chances of survival and having a better quality of life are increased when we're able to catch things early.
That sounds great. All right, and one more thing just to say is that if you didn't remember the details of if you should get screened, one of the things we just keep repeating is just get to a provider and ask them. Particularly if you have a history of smoking earlier in your life, do this because there's a chance that it could really save or extend your life right now. And with that, thanks so much for the work you do. Thanks to Roswell Park too, and hopefully we've demystified lung cancer screening for people.